Of course, you track the numbers on COVID-19. I try to put them out there every night for you. CDC is reporting that 1,626,066 confirmed cases have been reported in the United States. 95,906 people have died, but 311,422 Americans have survived to date. That said, I am very pleased and happy to be joined by one of those who have lived to tell her survival story. She is Mary Gay, the editorial board member with the New York Times. Welcome to the program, and it's good to see you.
Oh, thanks for having me. I appreciate it.
Okay, so you're a healthy, athletic woman, exercised regularly, New Yorker, and in the space of a few hours, everything went bluey. Walk us through what happened back in April.
Sure. I'm also 33, which, depending on who you ask, is I call it youngish. So certainly not in the category of people who were expected to be hard hit by this virus. But, you know, I'm a New Yorker, and we've been extremely hard hit here in New York City. On April 17th, I woke up and had a fever, knew immediately what it was, since already my neighbors and friends had become sick. I really haven't felt the same since. April 18th, the next day, I woke up with chest pain and difficulty breathing. I couldn't get a good breath unless I was on all fours. It was terrifying. I don't have asthma. I don't have any underlying conditions. As you mentioned, I'm a runner. And so I called a friend who is a doctor, and, you know, I ended up in the ER about an hour later. Fortunately, thank God, my oxygen was good enough that they were able to release me cautiously to manage the virus at home. I borrowed an oximeter, which I really recommend everyone get, or at least borrow. You can find one for usually under $60. It's this magical little device you put on your fingertip. It measures your blood oxygen level and also your pulse. In the event you become sick and you are having trouble breathing, call a doctor, go to the ER, check your oxygen level. If it's below 95, you need to go to the ER right away. That's what I was told. And so I just spent the next 7 to 10 days literally breathing through it and making sure that I was monitored. And the fear was that I would crash, because that's kind of what happens sometimes in COVID. And thank God I didn't. What I did do, though, unfortunately, is develop COVID pneumonia. And that's lingering. I still have that right now. It's getting better every day. But pneumonia, no matter what kind it is quite a recovery. So I'm 5 weeks into what's probably a 2-month recovery. I still can't go for a run. I use 2 inhalers twice a day, and I'm not really able to even do my own laundry at this point. It's difficult to lift things, and I'm still sleeping on my stomach. So again, this is someone who never had a breathing problem, never smoked a cigarette, 33 years old. So my message is just, you know, just take this virus seriously, even if you're not in a high-risk category.
And Maura, you've done a great job of explaining how your body felt, but tell us the story about your experience with the patient with the pacemaker in the ER that fateful day.
Yeah, I think, you know, one of the terrifying things, sorry, New York is still loud.
That's okay,
Just
no
even
worries.
in COVID. One of the terrifying things about this virus is how lonely it is for those who are sick, and for everyone in different ways. And when I was in the hospital, there were only 3 of us in the emergency room at the time. And it was myself and 2 older Black gentlemen, one of whom was he had a pacemaker, and he was talking to the doctors about how he'd been sick like this for a month. And then the other gentleman to my other side was homeless and was having trouble even speaking. And the doctors were taking x-rays of his chest. And so I still think about those men now. And I think for me, as a Black woman, it really hit home, because just knowing that Black Americans and Latino Americans, the Latinx community, and Indigenous communities are being hit so hard, and just living through that myself, it was just doubly heartbreaking.
Wow. Let me ask you this, knowing what you know and being where you've been, I'm wondering about your thoughts as the nation attempts to reopen beaches, the whole works. Are you concerned for the people who are ignoring those safety guidelines you just talked about?
I'm extremely concerned for Americans who maybe don't know anyone who's sick or just haven't seen the power of this virus up close. Yeah, I don't think it's reasonable to tell Americans to stay inside forever. I understand that people need to live their lives. They need to go to work. They need jobs. I would also like to go see my parents. I want to give my friends a hug. I understand all that. But my message is please understand that you need to take it seriously. If you are living in a place where things are opening up and you are in the vulnerable category, I would stay inside. If you aren't, I would say just do the responsible thing and wear a mask and try and give people the space that they deserve. Most people would never go up to a neighbor or a stranger on the street and kick them in the shin, right? So that's the equivalent of what not social distancing can do. Even if you yourself don't become extremely ill, which is a serious possibility, you could give the virus to somebody who is much more vulnerable. I would also note we've had over a dozen children who died of a suspected COVID complication here, kids under the age of 18. So what we thought we knew about this virus, we really are learning that we don't know. And then there's a whole category of people like me who weren't really supposed to be that sick at all. And we're going to be dealing with this for weeks and months at a time. So don't assume, oh, I'll just get a little fever and maybe have a cough and that'll be the end of it. You don't know how your body is going to react, and you don't want to bring it home or give it to a neighbor. So just take it seriously and respect what it can do.
All right, she is Maura Gay, the editorial board member with the New York Times, COVID-19 survivor. I wish you the very best of health and improving health along the way. Thank you so much for joining me.
Thank you for having me.
Have a good night.